This is just a wrist cuff blood pressure tester. If you haven't used one before, the technical term is a sphygmomanometer, but it's a lot like the elbow cuff tester, but it just does the constriction here. And a few things that I learned over the years and talking with a friend of mine who's a nurse practitioner and also a few doctors, a few things I've learned about these. You can use a wrist cuff sphygmomanometer or blood pressure tester effectively, but there are just a couple things you need to do a little differently. You don't just use this thing and stand with it hanging down low. It needs to be up above your heart, and probably you're going to be sitting when you use it. And this one just has a nice big readout. I've seen a couple that are pretty small, but you'll be sitting, rested. I would always recommend, if you're checking your blood pressure, count to 15 or 20, just sit there calmly, your feet not crossed, before you do it. And then when you're doing that, press start, and the unit will start tightening up on your wrist. And again, I'm just doing this for demonstration. This would normally be held across my heart like that, sort of across my chest. But it'll just tighten up, and then once it gets tight enough, it'll start decreasing in pressure. The blood starts flowing, and you get the diastolic number, that's the first number, and then the systolic number. Or maybe it's systolic, diastolic. Anyway, you get so first you get the top number, and then you get the bottom number. So you just have to be a little bit patient, and you will feel a little bit of a beating in your wrist as opposed to like the normal beating in your arm as that pressure comes down. And just check your normal ranges for your age. Usually anything under 130 over 80 or something like that is usually considered not a big deal. Mine usually comes in around 110 over 70 since I stopped eating high salt foods. So anyway, this is, I think, a pretty good blood pressure tester. Some people swear by the ankle, not the ankle. Some people swear by the elbow cuff, saying it's much better than the wrist cuff. If you want to, you can always calibrate this guy. Right now I got 94 over 56. If you want to, all you need to do, take this to the doctor's office and test it right alongside the one at the doctor's office. Almost any doctor's office will allow you to do that, and then you can calibrate it and you know what yours is versus the one at the doctor's office and see how close it is.